What can be done about the sudden onset of eye bags? I had eye bags appear almost overnight about a month ago. What can cause this?
Thank you for your question. You submitted your question with a photo, and you're asking what to do about under eye bags that appeared about a month ago suddenly. Well, certainly I can give you some guidance as to my impression based on your single photo in the absence of a physical examination, and share with you what I tell my patients who have similar situations as yours. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people with under-eye bags is something we do in our practice every day. And certainly this type of scenario where patients come to me and say, suddenly, overnight, they have under-eye bags. Well, I can tell you that from my perspective, just understanding the anatomy, that I think it's a little bit unusual for someone to have, as they describe, the perception and the true reality of, or I should say there's a distinction between the perception and the reality. One likelihood scenario, which is more plausible, is that you've had varying degrees of puffiness, and at a certain point it's reached a point where it's constant and that it is always present. A lot of times patients will tell me that there was a time when, before they came to consultation, where they would get puffiness, but they would do a variety of things, or they would get a good night's sleep and they would look good the next day. But then it would be what is described often as not so good days compared to very good days, and essentially when the not so good days outnumber the good days, you often find yourself seeking attention. So that being said, it is always important that if if there's a big change in your appearance, that you always check with your medical doctor and make sure that your general health is fine and that there's no issues with kidney function, liver function, etc. But given that, assuming that you are healthy, I think that what you can at least understand is what is causing the puffiness. And from this photo, it looks like what you have is called lower eyelid fat prolapse. Lower eyelid fat prolapse is essentially describing what occurs when the fat that's normally around the eyes pushes forward and creates this bulge that results in this constant puffiness. Routinely in our practice, for people like yourself, we do a procedure called lower eyelid blepharoplasty. And what that means is the puffiness is addressed surgically. Now, most people are hesitant to want to have surgery, and they try to avoid surgery by doing non-surgical things, whether it's creams or injectables. And certainly there's a role for non-surgical options. In our practice, I routinely help patients who have mild amount of puffiness under their eyes with injectable fillers to help blend the transition between the puffiness and the tear trough area. In your situation, however, I think the puffiness is more prominent and that it is likely to be more of a surgical solution. Now, when choosing a surgical solution, there are two options. One is doing the procedure from the outside, called a transcutaneous blepharoplasty, and the other is to do it from the inside, called a transconjunctival blepharoplasty. In my experience, and for a wide range of patients, I routinely address the fat pockets specifically from a transconjunctival approach. That means working from behind the eyelid to address the fat pockets and reduce them and sculpt them accordingly. A lot of times people are afraid that if we do just that, what are we going to do about the skin? Won't there be excess skin? And I help patients understand that it's not really excess skin most of the time, that it's actually about skin quality and not skin quantity. In particular, for males and for people who are in their 40s and older, tendon laxity and support of the eyelid is very, very important. And so it is other variables that also play a role in this decision-making process. Unfortunately, we have patients who come to us from all over the world with complications because their eyelids will be retracted or everted from having surgery done in a way which did not address all of the anatomic variables that can affect the position of the lower eyelid, and such that they need revision surgery, and often complicated revision surgery. When I'm asked about skin quality or wrinkling under the skin, I tell my patients that we routinely help our patients with under-eye wrinkling and skin quality with a combination of platelet-rich plasma, which is derived from your own blood and stimulates collagen and improves the skin quality, combined with laser. And laser, whether it's fractional CO2 laser or erbium laser, is able to freshen up the skin and improve some of these textural issues. And globally, between the puffiness and the skin quality improvement, you look better. And what's really great about under eye area is that it has such an impact on the whole face, because bags under the eyes really makes the face look tired. So I think that you're on the right path. And as far as the issue of overnight, as I said, make sure you see your medical doctor just to make sure everything is okay. But I think more likely this is just a cosmetic issue, and that it is a change that has become more persistent, and so you are appropriately in a situation that can be addressed surgically. So meet with qualified, experienced cosmetic surgeons and learn about your options, learn about the style in which the doctor approaches this issue, look at before and after pictures, and as often the case, people also want to choose a doctor also based on the type of anesthesia they have to undergo. We have patients who come from all over the world who come to me amongst the reason, besides the reasons of my specialization, but also because I do these procedures in my office under local anesthesia with light sedation, thereby avoiding general anesthesia altogether. This way our patients are able to be up and ready to leave without feeling any of the nausea and other issues related to general anesthesia. Again, it has to do with the surgeon's preference and whatever makes the surgeon, of course, comfortable. But in my practice, we've developed a nice system, and it works out very nicely to help people have the procedure with minimal sedation so that they don't have the anxiety of experiencing the procedure, and again, avoiding general anesthesia and being able to comfortably heal and get back to normal life in less than a week. So I hope that was helpful. I wish you the best of luck. Thank you for your question.